Ontario's vaccination clinics are suddenly full of young faces. Starting Sunday, any Ontarian aged 12 and up is eligible to receive their first dose of a COVID-19 vaccine. Lucas Lattonville just turned 12 this month.
It feels pretty good to know that I'm safer from COVID and it's a lower chance now.
Excited. We could start our summer right now. Feel some freedom, right?
Canada is doubling down on single doses. Just over 50% of the population has now received its first shot. But when it comes to the second dose, Canada lags far behind at just over 4%.
In Ontario, those lucky few who've received a double dose include frontline healthcare workers and residents of long-term care homes. Everyone else, including seniors and others with compromised immune systems, will have to wait up to 4 months.
Unfortunately, we have to turn some people away because, as you know, it's more important to get the first dose in.
Maria Elena arrived to get her 14-year-old vaccinated. She received her first shot last month and has an appointment to receive her second in mid-August.
Yeah, it's very too long.
Infectious disease doctors agree.
If you really want to focus on the most important numbers during the pandemic, which is hospitalizations and deaths, vaccinating younger people doesn't make as much sense as giving the second dose to the elderly individuals.
When it comes to the most vulnerable age group, those over 65, a CDC study found a double dose of Pfizer-BioNTech or Moderna was 94% effective at preventing hospitalization. But for those who'd only received their first dose, that protection dropped to 64%.
We do know that vaccines work less well in individuals who are older.
In contrast, Canadian youth represent less than 2% of COVID-19 hospitalizations.
Adolescents certainly are at a very low, vanishingly low incidence of severe illness. So in terms of vaccinating them, the priority is less so than, say, an 80-year-old in the community who certainly can get ill. This said, adolescents we are seeing are a significant source of transmission at the present time.
As Canada's vaccine supply soars, some provinces, such as Manitoba, are beginning to shorten the interval between shots for some at-risk groups. But as it stands, when Ontario emerges from its lengthy lockdown on June 2nd, that older, vulnerable population will still be waiting for its second dose. Jeff Semple, Global News, Toronto.